On Earth, a trauma bay can put a surgeon in the room in minutes. On Mars, light itself is the bottleneck. One-way communication can stretch from about 4 minutes when the planets are close to about 22 to 24 minutes when they are far. Round-trip advice can cost the better part of an hour. That is not a video call with lag. That is a different medical doctrine. This is Body Beyond Earth. Episode 5 asks what surgery looks like when Earth cannot scrub in. Low Earth orbit still lets flight surgeons coach in near real time. Ultrasound guidance, procedure talk-through, and rapid consults are real station tools. Deep space steals that loop. You can send a question and start working before the answer exists. Robot surgery from Earth sounds clever until latency turns every motion into a guessing game. Published reviews are blunt. Real-time telesurgery to Mars is not a near-term plan. Autonomy is not a slogan. It is the only architecture that matches physics. Expiration medicine planners track injuries and illnesses that would force an operating room on Earth. Appendicitis, trauma, dental emergencies, kidney stones, wound infections that escalate. On Mars, there is no ambulance to a tertiary hospital. Evacuation can mean months, not hours. So the medical system has to prevent what it can, diagnose what it must, and treat what it cannot avoid. Every unused skill and every missing supply is a bet against probability. Someone on board has to own the hard cases. Concept of operations documents put a physician astronaut in the lead for real-time events, with ground as consultant when delay allows. That person needs training, a trained backup, and decision support that works offline. Checklists, imaging, ultrasound, and procedure kits have to fit mass and volume budgets that also pay for food and fuel. If the physician is the patient, the backup plan cannot be a blank stare. Cross-training is not optional theater. It is redundancy. Even with perfect skills, the room fights you. Blood does not pool the way textbooks show. Tools float, fluids wander. Restraint systems and containment become part of the procedure. Anesthesia, infection control, and post-op rehab all change when there is no down. Partial gravity on Mars may help some of that, and it also creates a new unknown for how wounds and patients behave at 38% G. You do not get to learn that lesson on the first bad day. Delay is not the only silence. Conjunction geometry can put Earth behind the sun and create multi-day communication blackouts on some architectures. Bandwidth and network priority will throttle how much video and data you can push, even when the link is open. So the medical computer on the ship has to carry the library. Ground becomes a second opinion that arrives when it can. Design for the day the radio is useless, or you are designing for luck. Prevention first. Fitness, dental readiness, stone risk management, and careful EVA planning cut the chance you need a knife. Then onboard diagnostics, ultrasound, labs that fit a habitat, and decision trees that a trained non-specialist can follow under stress. Then procedure capability matched to the most likely life-saving cases, not a full Earth hospital packing list. Robot helpers may assist a local clinician someday. They do not erase the light delay. The unfinished unlock is a medical system that stays competent when Earth is only a recording. Scoreboard the idea. Station medicine still borrows Earth's near-live voice. Mars medicine must act first and consult later. Minutes of light lag rewrite who is in charge of the patient. Episode 5 takeaway is blunt. Treat surgical readiness like life support hardware. Train the crew, stock the kit, design for blackout. Do not confuse a good Earth doctor on a delayed screen with a surgeon in the room. Next time on Body Beyond Earth, we open who gets medically disqualified, the selection math before anyone leaves the pad. For now, remember the cold open. When the answer is late, the crew is the hospital. That is Body Beyond Earth on the Quantum Files. Subscribe if you want the next system when we open it.